This graph shows the course of an HIV infection in individuals who are not treated with antiviral medications. We can see that this graph has a double y-axis, with axis on the left side illustrating the CD4 count as represented by the red line, and then on the right we see the HIV RNA copies per milliliter, or the viral load, represented by the blue line. The x-axis represents time in months and years. We can see, as a general pattern, the CD4 count drops steadily and the HIV viral copies increase over time. However, if we look more closely at the graph, we notice it isn't a linear or exponential change in the viral load and CD4 count over time. There are some peaks and valleys that illustrate some important concepts. The first thing we notice is that there is an acute and a chronic HIV infection. The acute infection involves a viral load increase exponentially, as seen here, with dissemination of the virus and the seeding in lymphoid organs. We also notice an initial drop in the CD4 count. During this period, patients will experience a flu-like syndrome, fever, lymphadenopathy, malaise, headache, and myalgia. This is known as acute HIV syndrome. Now, after the acute HIV syndrome, the body's immune system actually begins to fight and win against the HIV virus infection. We can see here that the viral load decreases pretty significantly, and the CD4 count bumps up a little bit more in response to our immune system properly or adequately reacting against the virus. Now, during this time, the virus then enters a period of clinical latency that can last for years. Even untreated, it can last for years. But we can see that over 5 years, even with the viral load staying pretty constant, the CD4 count steadily is decreasing. It isn't until the CD4 count drops to about 200 when we begin to see the viral load start to pick up again. Remember, the CD4 level diagnostic criteria for AIDS is less than 200. So we see here at 200, that is the time when AIDS is diagnosed and the patient will begin to experience the dreaded opportunistic infections that will ultimately kill the patient. In addition to the opportunistic infections as the CD4 count declines, the patient may experience a variety of constitutional symptoms such as weight loss, fever, and chronic diarrhea. A good way to remember the progression of HIV is to think about it in 4 stages that all start with the letter F. Number 1, flu-like. Number 2, feeling fine. Number 3, falling count, CD4 that is. And number 4, final crisis.